Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President, and currently the President and CEO of the National Black Leadership Commission on AIDS, Inc. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. And today, we will talk about how to close the racial gap in the usage of medicine to prevent HIV infection. Tremendous strides have been made to lower HIV infection rates in the United States, in part due to medical advances. One such advance is the introduction of pre-exposure prophylaxis, also known as PrEP. This daily medication, taken in the form of an antiviral pill called Truvada, actually prevents the transmission of HIV virus between a non-infected individual and one who is infected. And many people are benefiting from it, and yet far too many don't use it or even know about it, especially in the Black community. So this year, the National Black Leadership Commission on AIDS partnered with the Black LGBT Alliance in New York State to find out why. And in a research project that was funded by the New York State Department of Health's AIDS Institute. Here to explain the research and results are Melissa Baker, Vice President of Administration and Special Projects at NBLCA, Jace Yzaguirre, who is also an intern in NBLCA's office, and we're so happy to have him join us, Sheldon Applewhite, PhD, a researcher at the Borough of Manhattan Community College, and Thaddeus Price. Thaddeus is the program director for our affiliate in Albany. Thank you so much, everyone, for joining us, because I know this is a very busy time, a very busy season, and the fact that you've decided to be with us, we certainly do appreciate it. Let me begin by just making a few comments about how we came to the point of partnering with the Black LGBT Alliance to even look at this, because while we all recognize that great efforts have been made to prevent HIV infection in the United States, many of the current findings still illustrate that the needs of Black men who have sex with men, Black gay, bisexual, and trans women needs are not always being met. And now that we have PrEP, pre-exposure prophylaxis, I should say, we're also recognizing that many in the same population, especially Black MSMs, are not using PrEP. Some of them don't know about it. So part of that is what led to the Black Alliance recommending that we work together to come up with a messaging project to see, are the messages resonating out there? Why aren't Black MSMs and transgender women using PrEP? And I think it's very important, too, to state that with the New York State blueprint that is now in effect, signed by our governor about 2 years ago, there are three major goals. One is to get people tested, get them linked into care, and the third is to educate around PrEP. And because that's one of the three major goals, this messaging project became that much more important. When we look at the population with the highest new infections, Black gay men. So it's important for us to know if the right messages are out there, are they aware, and are they also making use of PrEP? So that's how we got here with respect to this, and we hope to be releasing a major study about this probably in the next couple of days or certainly this week. So why don't we begin with you, Melissa, to talk a little about how the research was actually conducted and what we did in order to move this project forward.
Thank you. I think to start with, when you talk about the Black Alliance, the Black LGBT Alliance of New York State, it was really important that with our relationship, and BLCA has affiliates in Albany, Buffalo, Rochester, Syracuse, as well as Nassau and Suffolk counties, and we thought it would be important to focus in our cities where our program coordinators had a relationship currently in the LGBT community. And so with the program coordinators, some of our community partners, we had assistance in the cities to do outreach. We did some social media outreach as well as just working within our programming to solicit individuals between 18 and 29 years old that identified as Black, gay, bisexual, transgender women, or MSM. And then from that, we had a focus group. Each city, we actually did the focus groups in Albany. We did one in Buffalo, we did one in Rochester, and we did one in Syracuse as well. And although a lot of people think those cities are very similar, the reality is they are very different populations. So with the research, with the focus groups, each focus group had between 6 and 13 participants. And then Sheldon will eventually speak to more of how the research went in far as each individual focus group. But the participants participated, they answered questions. Of course, we did, fed them great food and always making sure that, we can make sure they have food. There was an incentive that was provided, a $50 incentive for their time. And it was approximately 3 hours, and that's from beginning to end. And what I will say, and a lot of people talk about incentives are important, but relationships are much more important, because in some cities, incentives were not what got people in the door. It really was relationships. And in cities where we were not successful, and we thought the $50 incentive would be the reason, we realized there's a lot more work that needs to be done, and we'll speak to those areas.
But I think, again, since this is one of the projects that we partnered with the Alliance, I don't think we started out thinking about doing it necessarily in our affiliate cities only upstate.
Right.
So why did we ultimately decide on the affiliate states?
The reality, I think it really started thinking about New York City. And so when the project was brought to NBLCA, the conversation was heavy in New York City. And what the NBLCA staff that were at the table explained is being in those communities and understanding they are much different, that it was very important that we gave voice to the communities for which our program, which we do every day.
Okay, and I know that each one of you around the table played a different role at different points in time. So, Dr. Applewhite, Dr. Sheldon Applewhite.
Yes, ma'am.
You want to tell us a little bit about the focus group itself in terms of how long were the focus groups in terms of length of time for any particular one, and just sort of that experience, and help us understand that process?
Yes, ma'am. So the focus groups, as Melissa explained, were typically it had around 6 to 13 people. New York City being one of the largest focus groups, and in some of the smaller cities we had smaller groups. We tried to design the focus groups to be a conversation, really sort of a fact-finding mission to see what the participants had to say about PrEP, what they knew about it, what they believed to be facilitators for using PrEP, or things that acted as barriers towards using PrEP. And I've read a lot of literature about PrEP, but to hear it on a first-hand basis from the participants was very interesting and very informative. We dealt with the population that's 18 to 29. And so while we believe we know a lot about this population, we really don't know much about their use of PrEP. And what we do know is, in the United States, that we have a very small percentage of utilization of PrEP among Black MSMs, ages 18 to 24, as Melissa may have mentioned. And we wanted to know why. We know that PrEP is effective. It's an effective preventative measure against HIV. And we do know that the black MSM or the black gay men share a disproportionate burden of HIV infection in the United States. One out of two black gay men will become infected with HIV in their lifetime, and so we wanted to know if this drug, which in some cases I would think of as almost like a miracle drug to prevent HIV, why aren't young black men using it, especially young black men who have their whole lives ahead of them? And so it was for me, on a personal and on a professional level, it was very important for me to find out what was on their minds when it came to PrEP. And we learned a lot of very interesting
And we're going to come back to a lot of what you learned in that process.
Absolutely.
I just kind of want to get all of us into the discussion. So as the youngest person here and someone who participated,
That's right.
what is it that you know about PrEP, and what was your role in this messaging project?
What I do know about PrEP is that it's a lifesaver. I'm extremely thankful for it. I wish more boys, young men in my community knew about it, and more importantly, trusted it. My part in the focus group was one of the young men. I just turned 20.
You just turned 20?
Just turned 20.
Oh my, I remember when I was 20. Seemed like it was yesterday, so
It was.
be careful.
And so they basically wanted to know why. I felt like I came from a different perspective. So like Sheldon said, he wanted to know why young black and Latino MSM were not using PrEP, whereas I was sitting there like, you guys haven't heard of PrEP? And it's interesting to find that they all use condoms, and condoms is normal and the go-to, but PrEP is this thing that's not real, that's not 100% effective, that is, you're putting HIV in your system. You're gonna catch HIV anyway. No one around me is on PrEP, so why should I get on PrEP? It's kind of like foreseeing you're gonna be on pills the rest of your life. And it was just, I enjoyed sitting there and listening to my fellow brothers and sisters in the LGBTQ community. So thank you for inviting me to the focus group.
Thank you.
And for someone, again, 20 years old, I think your voice is already incredibly important to have those conversations based on your knowledge, your awareness, and the lack of among a lot of the groups. So we're going to hear a lot about that. So Thaddeus, tell us, what was your role in the messaging project, and what made you involved, got you involved, I should say.
Well, I'm the program coordinator for the Albany affiliate. So my role in this project was to help coordinate the focus group in Albany. We partnered with one of our community agencies, Empower, who is a youth group focusing on MSM who are 13 to 29. And they provided us participants for the focus group. I also observed the focus group and had the, I had to sit back as Sheldon let me know. As an observer, I was not able to interject into the conversations because I didn't want.
It was hard, huh?
It was really, really difficult.
struggling.
It was really difficult because we didn't want my influence to skew the data.
Right, sure.
After the focus group, I was also able to provide the participants a PrEP 101 presentation to clarify or to demystify their perceptions and their myths and give them the truth about PrEP. The truth about its side effects, the truth about its effectiveness, and the truth about how strong of a prevention tool it is for HIV.
Can I just add something? One of the things that I thought was really great and dynamic about this project is that we did provide, and this is typically something that should be done at the end of a research project when you're doing focus groups, to provide the participants with information to improve their lives in whatever ways if they are interested. And one of the things that I loved about this was that at the end of the session, the focus group session, we were able to provide the participants with information and awareness about PrEP. And so, as Thaddeus being there as an observer, it was the first time of me meeting, or us meeting each other. It was really great because after the session was over, and there was a lot of misnomers about what PrEP is
Lots
and what
of
PrEP isn't,
misinformation.
and he was able to provide them with some really comprehensive information about PrEP. And I think it was very useful and helpful to debunk some of the beliefs that they had, but also to empower them to potentially get on PrEP. So I think it was really
So
important.
what was the age group that you worked with in the focus groups primarily? What was
18 to 29.
So it was actually 18 to 29.
Yes, ma'am.
And I wanted to say in regards to the Albany group, Empower is actually through the Damien Center. And one of the things when you talk about when I got feedback was, and Thaddeus actually at the time was newer to our organization, Empower works a lot with this community, and they said his PrEP 101 presentation did a lot. Like, this was the facilitator who runs the program, talked about, I've seen numerous PrEP presentations, but he really did engage the group. They answered a lot of questions. And so that goes to how information may be out there, but it may not be presented in a way that's engaging to the community. So
That's fantastic.
So I'm hearing a lot already that we need to, which relates to messaging, look at how we deliver that message.
Absolutely.
And you were going to talk earlier, Dr. Applewhite, about some of the findings and some of what came out. Maybe not necessarily the findings, but how you actually saw this coming together and your experience.
Yes, ma'am. Well, some of the things were, we were really fascinated by. We did have some major areas, and I want to just kind of go through each one of them, like sort of step by step. The first major area we found information about was around PrEP use. One of the things we found, as in Albany and several of the other cities, was that the population and our participants were unfamiliar with PrEP. They just didn't have information about it, and what information they did have, it was not necessarily accurate information. It might have been misinformation at times.
Secondhand.
Right, secondhand,
Third
or
hand.
right, or
no hand.
or no hand. Right. And sometimes they even went into providers and couldn't get adequate information about PrEP. And so that was something that we found was really really interesting, but also very useful in terms of where we go next as an organization and where we go in terms of getting young men to be on PrEP. We also found that that the participants felt like there needed to be more awareness, meaning that more information about PrEP needed to be sort of saturated in communities. And that not only includes advertisement, but it also meant that there needed to be a grassroots effort to do outreach in communities to let people know more about PrEP. Take, for example, Thaddeus' presentation. From the participants' perspective, there needed to be more information being disseminated in community centers, in schools, in the neighborhoods, so that people could know more about PrEP. The other thing we found, which was a big focus of our study, were the barriers to PrEP for this group. One of the big barriers was affordability. The population that we deal with are 18 to 29. So what we consider, I'm a professor, we consider that population to be a transient population. And so when I say transient, what I mean is that this is a population that may be transitioning into college, they may be transitioning from college into the workplace, or they may not be working at all, especially when we talk about Black young men, right? We know some of the barriers that they face. And so affordability becomes a real issue. Now, PrEP can be a very expensive drug. And so for some of the cities, we had cities like, for example, New York City, that offer, you could get PrEP offered for free.
Yes.
Right? Which is phenomenal. But then you may have a city like Buffalo, I shouldn't be naming the cities like this, where you may not be able to get PrEP for free, and it may be quite expensive depending on who your insurance carrier is. And so we found an unevenness, but affordability becoming a really big issue. Another big issue that I want to talk about is really stigma, which is a major finding. So many of the people on PrEP, who we had some people in our focus groups who were on PrEP, but even the ones who weren't on PrEP were concerned about stigma. And stigma came from two sources. Oftentimes it came from where the PrEP was being issued. And so what we found was that oftentimes where people were receiving PrEP were the same places where people were receiving STI screenings and treatment. And it was very, it was a negative sort of way of thinking about PrEP because, some of the participants just simply didn't want to be in those places because being in those places represented something bad or deviant and they didn't want to be seen by, their neighbor or their cousin, right? And so we found this to be a real barrier and stigmatizing for our participants. But another sort of stigmatizing factor was around providers. And we talk about community providers and medical providers. So let's talk about the community providers. Oftentimes, we heard that participants would go into places where they knew people from the community, the LGBT community. And oftentimes, these people who are there to support and provide services were the ones who were stigmatizing, participants who came in. And so that's really problematic. But there was also discussions from our participants around medical providers being stigmatizing, asking, well, why would you want to be on PrEP? Or I don't know anything about that. And feeling a level of embarrassment about talking about PrEP to their medical providers. So we have a lot of work to do around cultural
Even educated medical providers.
Absolutely.
Yeah. Well, let me ask you, Jace, in terms of your colleagues and your friends in that age group as it relates to the barriers that Dr. Applewhite spoke about. Is this what you're seeing or experiencing among your friends, or are there other barriers that you are aware of that we also need to, even if it didn't come out in the focus groups?
Well, everything that Dr. Applewhite is correct. I mean, also along with that, it's irrelevant. It's non-existent. Not only my friends, but people I'm around, they talk about sleeping with one another. Oh, it's nothing. It's not real. HIV is not real to my generation. We did not see what the older generation saw, which was kind of in reference, kind of like a Walking Dead. People were dying from it every week, every day. And so there's a difference in us seeing it and people who are older seeing it. People who are older saw it, so it's real, but to us it's not real. So if something's not real and it's just a rumor, we're not gonna take it seriously. We're not gonna go seek help. We're not gonna seek information about it because we don't think it's relevant to our lives because it didn't hit us personally.
So it sounds like we're at a real crossroads here because the numbers suggest that it is real. And the numbers suggest that it's this age population where we're seeing new infections. So we've got to come up with a breakthrough. What are some of your thoughts about what should that breakthrough look like? What do we have to do?
And okay, I know everybody's excited, but I know there's a lot that we all probably have similar conversations around. But from a programming standpoint, and some of the things that Sheldon mentioned, as you do travel across the state, and one of the things that really is an issue when you go into some of the communities where the communities are smaller. Where in New York City, I can go to Harlem if I live in Brooklyn and see a PrEP provider, or go to Queens. You're able to, you're a little more nomadic in the city. Where if you're in an area like Buffalo, Rochester, even out in Long Island, I spend a lot of time in Long Island. Your neighbor is possibly in your community center, and so understanding the importance of having a lot more providers to have as PrEP providers, but you have to start at the end of the day, no matter what, understanding that there's a confidentiality, there's a respect that has to be had. Otherwise, we're never going to get people in the door to have these conversations. And education is important, but I think also accountability. And we actually did a test in our office, a PrEP provider list was out. just call a phone number and see if that front person doesn't have the understanding of what PrEP is, and I'm calling to inquire about it. What are the chances I'm going to keep calling back?
Right.
Or what are the chances that I'm
gonna
going
feel
to
comfortable.
push through, that person to actually have those conversations? So there's a lot of things just on the front line that providers can do, in addition to the training of the staff, is understanding that the person that walks in the door is not going to always look like you, the cultural competency. And we talk about that and you hear a lot about it, but that's not just a one-day training. That's a lifetime training and constantly re-engaging. But people need to understand that in order for this epidemic to end, that we all have to look at some of the, as you say, stigma is huge, and I think everyone has some of it, and you need to be able to identify that.
Well, one of the things, and I'll get to you in a moment, Thaddeus, when it comes to trials, when it comes to unknown impact or effects of medication, we always go back to the Tuskegee experiments. And now when I look at the age group in which you say you work with 18 to 29, some of them may not be as aware of the Tuskegee experiments. And I was just curious that you find some of that coming into play. The fear, the stigma, and what happened there, and what does all of this mean about a new drug or a new medication?
Well, I'm glad you brought that up, because that is another barrier that was mentioned. We always talk about Tuskegee, right? And maybe the young people don't know about Tuskegee.
To the extent that we
Right,
do.
exactly. But their grandmother knows about it.
Exactly.
Their mother knows about it, right? One of the things, and I won't say the city, but there's a city that we were in that has a historical legacy, as far as some of the participants were concerned, of being discriminatory or reporting people from their families. And this is a hospital, and they just felt like they couldn't go to that place for service. And so what I'm saying is, I'm a sociologist, and so we talk about like sort of structural discrimination and historical legacies of discrimination. And so if you grow up in a community where you have been marginalized by the institutions that are supposed to serve you, that carries over, and so if your grandmother tells you, well, don't go to such and such hospital because they'll report you if you go in there with a broken arm to ACS or whatever, then that's something that a young man is going to remember, and they'll think about when they decide to look for services or whatever. Human beings are very sophisticated, and we make up sort of rationales in our mind when we do things or when we decide not to do things, and I think that's relevant here when we talk about fear. And fear side effects was a big issue as well, like really serious concerns about how this drug will affect the liver, how this drug will affect weight gain, what are the long-term effects of this drug, and if the long-term effects is that weighing the costs and benefits of taking that drug as opposed to becoming infected with HIV.
And using other precautions to
right.
perhaps try to prevent
Absolutely.
like the use of condoms.
I think what Jace says is really relevant. He's growing up in a community and a generation where they don't see people ravaged by HIV. And I think that matters. And we can't undervalue it. I mean, and it also speaks to what they've been seeing in terms of public health messages. What the participants talked about in their public health messages and advertisements is that they see people running around sunny, happy,
Cute.
strong, like sexy, and it's like, it's very contradictory to what HIV is supposed to be about. And so I think it leads to some uncertainty about what effect this disease has on oneself.
Right. The media is almost a misinformation.
Yeah.
Right. Thaddeus, you wanted to make a comment?
Yeah, I wanted to go back to the conversation about providers, because there is a huge need for education for providers. There's a great reluctance among providers who are not specialized in HIV for prescribing PrEP. Anyone who has a license to prescribe drugs in New York State is able to prescribe PrEP. That's nurse practitioners, physician's assistants, doctors. It's not limited to HIV specialists, but folks who are outside of the HIV specialty realm are very reluctant to provide PrEP. They're sort of scared because it's out of their wheelhouse. So they would rather leave it up to the PrEP or to the HIV providers, which contributes to sort of the stigma that folks are experiencing. Folks can only access PrEP at places where you also access HIV care. So we need to do some work around sort of making PrEP a standalone service, a standalone service separate from HIV care, and sort of make that distinction very well known.
It's interesting that you talk about the education for providers, and again, maybe we become too New York City centric.
Well,
Because I know that there are a number of initiatives and education programs that provide education for providers. Mount Sinai doing a big job in that area, and so many others, not just to mention Mount Sinai. But providing the education for providers is a big deal. So are you saying you're seeing it different in other parts of New York State?
Can I just jump in for 1 minute?
Okay.
We like to think of medical providers as gods, right? But they are human and they have their flaws as well.
And their biases.
And their biases. A study came out in 2009 in the American Journal of Public Health that talked about black MSMs. And the report said that black MSMs were less likely to reveal their sexual orientation to their medical providers. What the study really didn't do as well for me was talk about the idea of why people don't disclose their sexual orientation to their providers. It's because they get feelings around stigma in terms of their being gay or bisexual or whatever. And so I do believe, and I'm bringing this study up because I do believe there's a lot of work to do in terms of providers constantly getting that training to sort of be sensitive to the needs of their patients. As an educator, we're constantly getting training, to the newest innovations, the newest type of students that are coming in. I think medical providers need to do the same thing, and that includes HIV, new drugs that are coming out, dealing with new populations like trans populations. I don't think it's enough to say I didn't get my specialization in this area, so I don't need to focus on that.
So
Melissa?
I just, and not that I have physicians that I know that are personal friends of mine, but I think back when I look at how PrEP is being treated with the medical community, I think about when HMOs, I lived in California at the time, they said your OBGYN could be your primary care physician. And every OB that I knew was like, absolutely not, because I don't want you coming in here for colds. I'm delivering babies, and this is my specialty. This is going to add to my, visits and all of these other things. It was like one more thing added to my plate. Wow. And so from a programming standpoint, I think there's things that we can do to work with providers to say we understand that. And so there's a couple of things we can do. We can work with you to partner you with other community-based organizations to do some type of education so that you understand that there's a support system that, maybe it takes time to get them to a place. We did in Buffalo, our office in Buffalo is located at the Community Health Center of Buffalo. And at the time we moved into the space, they were not prescribing PrEP. And one of the great things that we've talked about is the need for more FQHCs to actually be PrEP providers, because then you walk in there.
FQHCs.
Oh, I'm sorry.
Yes. In this field,
we're talking about
all of these.
So federally qualified health centers.
Thank you.
And the need for them to actually be providers, because we all walk into them for a menu of items. And so that reduces the stigma. And one of the things that we've been doing in Block of Programming is doing presentations with the federally qualified health centers, and I'm talking the staff. And we did that at the Buffalo Community Health Center of Buffalo with the staff. Receptionists is all. The providers actually knew about PrEP, and as well as the president of the Community Health Center. And within 3 to 6 months, they're prescribing PrEP. They immediately got on board and understood the importance of that, and I think we can do more of it. But they also look at us as partners. And one of the things that Dr. Ansari, who's the president, said is having a relationship with a community-based organization to kind of help do some of the community work took some of the burden off of her. So people coming in had a little education, but it also allowed her to work with her staff, and we work with the community. So that's where the partnership came in place.
Okay, well, let me go back to Jace for a second, because I'm really, focused and concerned about this population that you are interacting, and the fact that they have not seen what we have seen and are not processing it. That if, and I've heard this, that if one becomes infected, all they've got to do is pop a pill, understanding that there is no pill, no cure for HIV or AIDS. And of course, if one is positive through medication, they can live a better quality of life. So what is it that you learned that they are doing or talking about with at least the use of condoms and safer sex?
As far as the youth, their opinion,
Yes.
their take on it,
Yeah.
it's, I can tell you that safe sex is not discussed. It's not that we're not doing it. I just believe it's where there's this mentality of in the moment. And during the ages of 18 and 29, if you're not studying or working or putting your mind to educating yourself, you're taking in television and you're taking in music. And so when you're seeing these people on television, you're seeing over-sexualized people having sex, but not discussing condoms, not discussing PrEP, not discussing PEP, which is extremely important, which I really can't wait for NBLCA to do a study on that so we can get people utilizing PEP.
What's PEP, Jace?
Yeah.
PEP? It's post-exposure prophylaxis. So you want to go to the emergency room within 36 hours to request the 2 pills, and it's 3 tablets, and you're on it for 28 days, and it stops the transmission
I
of HIV.
see you really up on it. That's
But
really
that's important
great.
because
Yeah,
it's extreme.
absolutely.
I mean,
For
it's
potential
yeah.
exposure.
I mean,
Yeah.
because
Potential exposure.
PrEP is a whole commitment. That's a
Yeah.
lifestyle. But PEP can really save lives for the people who are just having sex for the first time, but only because Johnny or Lynn said they won't leave me because I'm not having sex, and we can only have sex raw. Or for rape victims, or people who didn't have a choice in their bodies, they have a way to fight that infection. If that
But we want to
person-
make sure we
yeah.
don't send the message that PEP is an
Right.
antidote or a response to just random sex with
Oh,
no
absolutely not.
responsibility.
But it will show you, it does give you a highlight or what life could be like as a positive individual, because you are on the drug for 28 days. There is that possibility that you'll be taking more than 1 tablet a day. It opens your eyes to what sex is not just intercourse. It's more of you'll take sex more seriously. You just won't.
Right. A real
Consequences.
commitment. So we've talked a lot about the findings. So Dr. Applewhite and everyone else, you want to talk a little about what are some of the recommendations coming out of this messaging project? Because I think we've established the fact that whatever the messages that are out there right now, they're not resonating. And much more work. So what are some of the recommendations coming out of the messaging project?
Well, I'll start with 2 things. One is based on one of the first things we talked about is this idea of doing grassroots sort of targeted like mobilization and outreach around PrEP. We need to get the message out in communities that are disproportionately affected by HIV. And so, as I said, holding town hall meetings, going into community centers, going into schools. What we're finding is that increasingly we're finding younger people who are becoming infected with HIV, and that's why we're looking at this age group of 13 to 24. In our study, it was 18 to 29, but increasingly maybe we need to be in junior high schools and high schools talking about PrEP. Now, some people, for moralistic reasons, have problems with that. But what is it like to be 15 and infected with HIV, as opposed to being on medication that can potentially prevent you from becoming infected? Another thing we need to do, and you all talked about it, was this idea of more education and awareness that includes not only in communities, but for providers, community providers and medical providers. And then one of the things I want to talk about is really changing the messaging, right? A big emphasis of this study was looking at the type of messages that are out there currently. And when I say messaging, I'm talking about advertisements, billboards, so forth. And we held a special focus group that really looked at some of the images around PrEP. And what we found were that the images really didn't speak to the population that they're trying to serve. Sometimes the images were too provocative. They were too sexualized. Some of the participants felt like that the ads over-sexualized or objectified and stigmatized the population that they were intended to serve. And so you heard that, and on one hand you heard that, and on the other hand, you also heard that the message needed to be more widely distributed. Meaning, in other words, like it shouldn't only focus on Black gay men.
Right.
To be very honest, PrEP is something that anyone can use if you're HIV negative and you're trying to prevent yourself from becoming infected with HIV. So why isn't this message being spread not only in the Black gay community, which is impacted heavily, which has a disproportionate amount of the HIV burden, but what our participants said is that this message around PrEP should be spread to all communities. So we understand the importance of tailored messaging, and they wanted tailored messages that speaks to their lives. But what they also said is that it should be widely distributed. We have sisters and aunts and cousins who may be female who could benefit from using PrEP.
Right.
We have young people, adolescents, who may benefit from using PrEP. And so just getting the information out there will lead to more awareness, and it will get it in the hands of the people who really need it.
And it'll put more positive spin to PrEP. If you're talking to the Black community, Hispanic community at large, and we've had conversations in churches, and you have the faith community, and someone's grandmother say, "Baby, I'm going to take this and talk to." So it generated a conversation. But I want to go back, and I know Thaddeus, and of course, because Jace is in that age group, when you talk about school education, and we talk a lot in BLCA about sex education and the importance of health education, which sex education is a part of, and
Absolutely.
the need to be having conversations in middle school and high school so that when the decision is made to engage, your child has the tools they need to make better decisions.
They can make
And
the
I
most
think that-
informed decision.
Yeah, and I was just going to say too, I think, we're very appreciative for support through the New York City Council anyway, and a recent grant is going to allow us to do some work in the public schools.
Absolutely.
And I think that we're looking forward to that based on what you're saying with respect to much of what you came up with. Thaddeus?
The more conversations we're able to have in the community about PrEP, the more communities we're able to educate about PrEP, the more we're able to normalize PrEP. We need to make PrEP a normal household discussion item. Something that people are talking to their children about at dinner, something that parents are discussing at night, something that everyone is aware of. We need an awareness raising campaign that is PrEP positive. That is PrEP positive. We also need to, going back to the focus group in Albany and the PrEP 101 presentation that I delivered, we need to provide medically accurate information to these communities about PrEP. We need to dispel the myths, and we need to use folks who are able, who the participants are able to connect with. Those guys in Albany were able to receive this information from me way differently than they had received it from any other provider, any other agency, and it was sort of about meeting them where they were and being culturally competent, and being able to deliver the messages in ways that were easily digestible and easy to understand.
You know, it's so interesting as we have gone through this discussion, because there are many tables I sit at, as several I know of you do. And at these tables, whether it's in Washington, Albany, or here in New York City, it's almost a perception that there is a great deal of information out there, and this information is reaching everybody. Therefore, people are well informed, much more informed than what I'm hearing you say you are able to get from the research, the focus groups that you did. So if you listen even down to the Center for Disease Control, that with all of the information that is out there, to say people don't know or people are not well informed, how do you respond to that, given what you just came through out of this group? Starting with Thaddeus, then Dr. Applewhite, Melissa, Jace. I see everybody's trying to jump in.
The availability of information alone does not change behavior.
Correct. Thank you.
You know, there is a plethora of information out there, and let me give kudos to New York State, because New York State is doing a remarkable job with their information about PrEP. With the information about for the providers, they have a provider education line. They give you clinical guidelines. They give providers a step-by-step directions on how to prescribe PrEP, who to prescribe PrEP to, what the side effects are, and all of that information is available for providers. But if the provider isn't keen on learning that information, if the provider is reluctant to provide PrEP, then that information just sits there. And I'll defer.
Doctor?
I think what Thaddeus said is like right on target. I think, as a professor, and as a public health, researcher, there are times when we sort of sit in our bubble and we think that, all this information is available, but unless it is sort of, one thing about research is it's not research until it's like sort of disseminated and people learn this information. And so I think I hope everyone would agree, in a public health community, that there needs to be more information sort of disseminated about PrEP in general, but specifically the communities that are like really heavily affected. And I don't think anyone out there would deny the fact that, the Black community, the Black LGBT community needs more information about PrEP, like a sort of a very grassroots, basic level awareness about PrEP, and there needs more needs to be done.
And so as you talk about that and a lot of the work that we're doing in other cities, and when you talk about, I always think about responsibilities, because providers have a responsibility, but the community has a responsibility as well. And so as a community-based organization, our goal is, and we do a lot of grassroots work, and a lot of the organizations we work with do as well, but we also know that there's no HIV information. You used to could go and you would see signs about smoking everywhere. So the need to disseminate that information in laundries, and when you talk about there's a lot of information out there, but where is it located?
And what is it saying?
Where's the messaging? Like, it's like, if you go to Facebook, is there a message about, you can get fake news about some of this political stuff, but is there real information and real messaging where we know the Black community is? They're online, they're in barbershops, they're in laundromats. I'm talking about bulletin boards, going back to the old way of doing things. But more importantly, as we talk about town hall meetings, really challenging and encouraging our communities, our families, to have a conversation, because we have got to realize that our responsibility, our kids are dying, and it's our responsibility to make a difference. So when we're communicating, really stressing that point, at the end of the day, it's going to stop with us.
Absolutely.
I would just, everything they said is absolutely I would say two things. One would be, yes, information's there, but what's going to make somebody stop and read it? If I feel as though the Black and Latino community, we're very like, my mama taught me, my coach taught me, my grandmother taught me, someone taught me. So if you're not hearing it from them, what you say and what you're saying or what somebody is telling me is not correct. So if we take the time to partner with local sport communities and tell them, hey, can you talk to your football players about this? Or local dance classes, can you talk to your girls and boys about this? Or the local science club, talk about this. It's taking a mentor to a group of people and telling them that information, and also just discussing sexual pattern. We talk about PrEP and PEP, but sexual pattern is very important when it comes to PEP and PrEP, and that's not taught. Like, people aren't taught about, you know, how long between, how many sexual partners between each. I'm not sure what you know what I'm
We're
saying.
talking about sexual health education,
Right.
Or the lack thereof.
And not black. It's
Right,
not
right.
black and white.
The lack thereof.
But I think even giving Jace credit, Jace, we did meet Jace in New York City in our focus group, and he presented himself very early on. And what we saw was the value of who he is and how he's able to articulate the message, and having people in that age group to have this conversation. So as we mentor more, it's important for Jace and that community to be a part of ending the epidemic. We can't all be between the ages of 40 plus making all the decisions. We have to understand the youth have to be at the table.
Absolutely.
And the fact that we have this great, we have all ages here.
very
And so
inspirational.
that is the key, because people who came before me know things that I don't know, or have experienced things that I haven't yet experienced.
Well, on the other side, it's like this experience for me doing this project was me really hearing from your age group about what's happening. You know, it's like, you know, I'm a black man, I'm a black gay man, but to hear it, you know, I'm not of your generation. And so to hear you saying what is sort of impacting your generation in terms of using PrEP or not, I think that was really important for me to hear. Because we think we know a lot, and we may not really
We're
know
no
what
longer
the
happening in the
right.
streets, as they say.
We're no longer popping, right?
And I think that's what makes this research project so important, because we're giving voice to folks who we have not heard from,
Absolutely.
folks who have not had a chance to tell their stories or to give their voice on these things. We've got a gold mine here. It's a jewel that needs to be disseminated widely.
Which leads to the last question. And I think that's an important point you just made. Giving voice to people, to persons who have a lot to say, but no one is listening to them, or they're feeling that what they have to say is not that important. So, what is the next step in terms of continuing to involve this cohort of persons who participated in the group, and where are we with respect to releasing of the project?
Can I start?
Go here, then Melissa.
Well, I think about my own experience with becoming involved with like HIV prevention, and somebody like groomed me, somebody mentored me at a very well, not young. I was around 26. I just finished graduate school, which is sort of different from a lot of the young men in our study, but someone took me under their wings. You know, a man who was running an organization in Brooklyn. I just walked in out of interest and wanted to do something for my community, and he said, "Come on, join in. You know, you can write for our newsletter." And slowly but surely, I became involved. And so I think it's important. It behooves us to make sure that we give opportunities and nurture young black men, young black gay men. And I think, I want to say, as an independent researcher, I really appreciate Blockers' role in terms of trying to develop and cultivate those relationships with young men. I think it's important. I think we have a generation who, we had these things when I was coming up, your mother who or your family who, these were people who told you how to live your life as a young black gay man. And we need more of that. We need more elders, and I consider myself an elder, sort of nurturing and guiding and mentoring younger black men. Black men in general, but black gay men specifically, right? And I think that's important. And I think that work will see itself in our community.
Absolutely.
Melissa, so where do we go with the report?
And so I can't fail to mention our transgender women. We do a lot, and we work with New York transgender advocacy groups, so I just want to make sure that we acknowledge that they are also a part of this conversation, and we will continue to work closely to make sure that the messaging and the things that we do include them. So as Ms. Fields said earlier, we are, steps away from releasing the report. We're upon the holiday season, so I don't want Santa Claus and God's
overshadow, right?
God's birthday to, they're much grander.
Right.
So I want to be able to find our space. So we'll have a conversation as to when it will be physically released to the public. And then we will start talking about doing some test messaging. But what I think is important, and we heard a lot during the focus groups, is the need to continue to engage the participants. So in the various cities, we will go back to them as we are crafting and working to develop messaging, to utilize them in their social marketing, their social media avenues, to be able to test these messages. And at the end of the day, for us, by us. So doing things with our communities, intergenerational, to make a difference in our communities.
Okay, let me say this has been very, very informative, and I'm so grateful that all of you were able to come and participate, and you've certainly provided a wealth of information. I want to thank again the Black LGBT Alliance of New York for the role that they played in making this possible, and thank Dr. Applewhite, Jace Yzaguirre, Thaddeus Price, Melissa Baker, and for all, and of course the New York City Department of Health AIDS Institute for making this possible. This has been a very, very informative discussion, and I look forward to moving forward to make sure that the report is well distributed and that there is follow-up with respect to a lot of the issues that you've talked about: discrimination, the side effects, affordability, stigma, providers needing more support. And I think the work that we're looking to do or continue to do through community mobilization will enable us to address all of it. So thank you, thank you, thank you. And for more information about the messaging project report on PrEP usages at NBLCA's website, NBLCA.org. Look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube as well. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this programming. Again, I am C. Virginia Fields, and I thank you for joining us, and hope you'll tune in next time for NBLCA's Health Action TV here on Manhattan Neighborhood Network.